Hi everyone, let's start our day 2 challenge. In this video, we are going to see about the skin of newborn. Let's start the video with a beautiful quote. Life is like riding a bicycle. To keep your balance, you must keep moving. Life is like riding a bicycle. To keep your balance, you must keep moving. First, let's see about the skin of the baby. The normal skin of the baby is pink in color. Then let's see the poster of preterm baby and term newborn. Preterm baby often maintains frog-like posture and sometimes the babies will be in extended posture. And the term newborn, they will be flexed position. The babies, they will be having flexion of head and extremities which rest on chest and abdomen. Next, let's see the skin color. The baby, if their hands and foot is blue in color, then the term is known as acrocyanosis. And if the baby's body is blue in color, then mottled blue skin. And if the baby's skin and eyes appears yellow in color, means it indicates jaundice. And if there is bluish discoloration of hands and feet, then it is termed as acrocyanosis. Next, if the baby's skin color is yellowish in color, it indicates jaundice. Normal babies will be in pink in color. Next, see the terminology lanugo. It means soft fine hair that covers the body and limbs of a human fetus. Lanugo, soft fine hair that covers the body and limbs of a human fetus. Next, congenital or subcutaneous skin lesions. First, macule. It is a discolored spot on the skin called freckle. Second, wheal. A wheal is a localized elevation of the skin that is often accompanied by itching. It means urticaria. Third, papule. It is a solid circumscribed elevated area on the skin called pimple. Fourth, nodule. It's a larger papule called acne vulgaris. Fifth, vesicle. It's a small fluid-filled sac called blister. A bulla is a large vesicle. It is common in chickenpox due to varicella virus. Sixth, pustule. It's a small elevated circumscribed lesion of the skin that is filled with pus, termed as whiteheads. Seventh, erosion. Erosion or ulcer is an eating or gnawing away of tissue. It's known as decubitus ulcer. Eighth, crust. It's a dry, serous or seropurulent brown, yellow, red or green exudation that is seen in secondary lesions, eczema. Next, scale. It is a thin, dry flake of cornified epithelial cells such as psoriasis. Next, fissure. It's a crack like sore or slit that extends through the epidermis to the dermis. It is known as athletic foot. Next, vernix caseosa. It's a white, thick, waxy, cheese-like substance that protects the baby in the womb. Vernix caseosa. It's a white, thick, waxy, cheese-like substance that protects the baby in the womb. Next, skin turgor. Skin turgor is the skin's elasticity. It is the ability of skin to change shape and return to normal. Skin with decreased turgor remains elevated after being pulled up and released. Skin turgor test. The skin fold persists after a pinch and release. Tissue turgor. Grasping the skin between thumb and index finger returns back to normal within 2 seconds indicates that the newborn is well hydrated. Decreased skin turgor indicates dehydration. Turgor time and indication 1.5 seconds or less. It indicates less than 50 ml per kilogram fluid deficit. 1.5 to 3 seconds, it indicates fluid deficit between 50 and 100 ml per kg. More than 3 seconds, it indicates fluid deficit of more than 100 ml per kg. Next, desquamation. It is known as skin peeling or shedding of skin. Physiological jaundice. If the baby's skin and eyes are yellowish in color, it is known as neonatal jaundice. It means excess bilirubin in the blood. If the bilirubin moves from bloodstream into brain tissue, then the condition is known as kernicterus. If the bilirubin moves from bloodstream into brain tissue, then the condition is termed as kernicterus. Extent of jaundice. If the face and neck appears yellowish in color, it is termed as grade 1 jaundice. And if the baby's chest and back is yellowish in color, it is termed as grade 2 jaundice. And if the baby's abdomen below umbilicus to knees appear yellowish in color, then the baby is under grade 3 jaundice. And if arms and legs below knees appears yellowish in color, then grade 4 jaundice. And if hands and feet appears yellowish in color, then the baby is having grade 5 jaundice. Next, forceps marks, a bruising of the face caused by the use of forceps during delivery. It will disappear in about 6 to 12 weeks. Telangiectatic nervi or Solomon patches or spider vines or angiectasis or angel kiss. The small dilated blood vessels near the surface of the skin or mucous membranes or spots appear on the face and neck, eyelids, upper lip, back of the neck and forehead. This is termed as angel kiss or telangiectatic nervi, Solomon patches or spider vines. Bruising of tissues. Some babies may show signs of bruising on the face or head simply because of the trauma of passing through the birth canal and contact with the mother's pelvic bones and tissues. Mongolian spot. Mongolian spots are congenital birthmarks seen most commonly over the lumbosacral area. They are bluish green to black in color and oval to irregular in shape. And if the baby's hands and feet is bluish in color, then the term is known as acrocyanosis. Acrocyanosis means bluish discoloration of the extremities due to decreased amount of oxygen delivered to the peripheral parts of the body. Cutis marmorata. Cutis marmorata is a transient skin disorder in which the skin has a bluish red marbling pattern when exposed to cold temperature. Cutis marmorata, it's a transient skin disorder in which the skin has a bluish red marbling pattern when exposed to cold temperature. Harlequin color change. Harlequin color change is a cutaneous condition seen in newborn babies characterized by momentary red color changes of half the child sharply demarcated at the body's midline. Here, the half part of the body will be red in color and the other will remain pink in color. Erythema toxicum. Erythema toxicum is a common rash seen in full-term newborns. It usually appears in the first few days after birth and fades within a week. scleroderma neonatum or paniculitis. It means inflammation of the subcutaneous tissue. Paniculitis or scleroderma neonatum, it is known as inflammation of the subcutaneous fat. Next, cafe or light spots. Presence of light brown spots or pigmented birthmarks, and if more than 6 cafe or light spots indicate the genetic condition neurofibromatosis type 1. Nervous flames or port wine stain. It's a non-neoplastic congenital dermal capillary hematoma. It means abnormal mixture of cells and tissues. The malformation presenting as a pink or red patch on a newborn skin. Nervous flameus or port wine stain. This is a non-neoplastic congenital dermal capillary hematoma. It's an abnormal mixture of cells and tissues. It's a malformation presenting as a pink or red patch on a newborn skin. Next, birth injuries. First, soft tissue injuries. It includes abrasions, bruising, fat necrosis, and laceration. Second, extracranial bleeding. It includes caput succedaneum, cephalohematoma, subgaleal hematoma. Third, intracranial bleeding. Subarachnoid, epidural, subdural, cerebral, and cerebellar bleeding. Nerve injury, it includes facial and cervical nerve roots, Horner syndrome, recurrent laryngeal nerve damage. Fracture, it will be commonly present in clavicle, humerus, femur, and skull. Next, dislocations. Next, torticollis. Its injury occurs in sternocleidomastoid muscle. Eye injuries include subconjunctival and retinal hemorrhage, and solid organ injury occurs in spleen, liver, kidney, and adrenal gland. Horner syndrome. It's a condition which includes dropping of eyelid, meiosis, that means constricted pupil, and facial anhidrosis, it means loss of sweating. Horner syndrome is a rare condition classically present with partial ptosis, that means drooping or fall of upper eyelid. Meiosis, it means constricted pupil, and facial anhidrosis, it means loss of sweating due to disruption in the sympathetic nerve supply. Next, abrasion. It's an area damaged by scraping or wearing away. Bruising. A bruise forms when a blow breaks blood vessels near your skin surface, allowing a small amount of blood to leak into the tissues under your skin. The trapped blood may cause a bruise that at first looks like a black and blue mark and then changes color as it heals. Next, fat necrosis. Subcutaneous fat necrosis of the newborn is an uncommon paniculitis. It means inflammation of subcutaneous fat of neonates. Classically, red-brown or violaceous subcutaneous nodules and indurated plaques develop on the back, buttocks, proximal extremities, or cheeks within the first few weeks of life. Lacerations. Infants may be cut by scalpels or other instruments during delivery. Most fetal lacerations are minor and resolve quickly after minimal treatment is provided in the delivery room. Caput succedaneum. Caput succedaneum is a swelling of the scalp in a newborn. It is most often brought on by pressure from the uterus or vaginal wall during a head first delivery or vertex delivery. Cephalohematoma. Cephalohematoma is blood that collects between newborn scalp and skull. Hematoma means blood that pools outside blood vessels. Cephalo refers to the head. This type of birth injury occurs when pressure on a baby's head ruptures blood vessels in the scalp. So if there is edema, then the condition is termed as caput succedaneum, and if there is blood collection, then the condition is termed as cephalohematoma. And subgaleal hematoma, if below the epicranial aponeurosis and periosteum, if there is blood collection, it is known as subgaleal hematoma. And if there is blood collection between the brain and skull, then it is known as epidural hematoma. Torticollis. It is a short, tight sternocleidomastoid muscle. So let's end this session with a beautiful quote: a kind word, a genuine smile, and a warm gesture can send the best vibes. Until then, shine off from Angel. Thank you.